I'm Mark Soroy. I'm a physical therapist and clinic director at Advanced Physical Therapy in Southgate, Michigan. Advanced Physical Therapy has 9 clinic locations throughout Metro Detroit. To find out more about our facilities and services, visit us at advphysicaltherapy.com. That's advphysicaltherapy.com. I'm here today to talk about our treatment approach to plantar fasciitis or plantar fasciopathy. The treatment I'm going to talk about today is a generalized approach. We base all of our treatment off of a comprehensive musculoskeletal evaluation. We may do more, we may do less, but this is based on our evaluative findings. Today, what I'd like to talk about is our generalized approach. I have Jacques here. He's a local cross-country and track runner, and he's been plagued by plantar fascia problems. Generally, we may start with treatment including ultrasound, which is used to pre-warm the tissues. It also has a beneficial effect on inflammation. I'm going to have Jacques lie stomach down. One of the very useful treatments we find is the use of Graston, which is an instrument-assisted soft tissue mobilization technique. We have specialized stainless steel instruments that are used to both detect and treat areas of scar tissue, areas of fibrosis, areas of soft tissue restriction. We utilize this treatment with a specialized emollient, which allows the instruments to glide through the skin, over the skin, and we'll look at the whole calf area and through the plantar fascia. We use these instruments to scan for areas of restriction. We'll feel a grittiness or a general sense of bumps in the road through the tissues here. We scan in both directions, different areas that we're working on. If they're fibrotic or tight, we'll start to notice some reddening, which indicates an area that needs some work. We'll also scan through the plantar fascia and work to identify areas of restriction through this region. The treatment with Graston, after we scan and identify the areas of restriction, we localize our treatment with Graston to those regions. Generally, Graston is done twice a week. Even if the patient is coming 3 times a week, we may limit to every other day or simply twice a week. More is not better. Generally, it will take 2 to 4 weeks of Graston to help clear up some of these restrictions. Specific to plantar fasciitis, the sequence of how we treat is important. We'll treat with the heat to preheat the tissues and make the tissues more pliable. We'll then follow up with Graston or other soft tissue treatment approaches. Sometimes it's as simple as utilizing a foam roll and having the patient do some self-soft tissue work. After Graston, we'll do specific stretches to load and help realign the tissues, and then specific strengthening exercises as well. Primarily with plantar fasciitis, we're finding mobility restrictions, which Jacques has. Our functional movement screen will help to identify areas of restriction throughout the body, and we treat those areas of restrictions. We're looking to normalize biomechanics with the area. Another treatment that we utilize that's very effective following Graston is the use of a cold laser. We have the ML830 cold laser that is useful in helping to stimulate healing. Ice is also very helpful in this, and patient education is critical. If you'd like more information about our services, contact our clinic at 734-284-6582 or visit us at advphysicaltherapy.com.